A number of the questions are about or some of them, about what the medical providers and the health insurers could be doing, both at this moment, but also in preparing for a future in which the coronavirus is likely to be with us for some time. What are your recommendations for the medical care system and the health finance system?
Yeah, boy, that's a great and broad topic. I think this has been a good reminder and a wake-up call for us that as much as we kind of talk theoretically about emergency preparedness and expecting that pandemics are a question of when, not if. So this is a real reminder that wasn't just a theoretical, academic supposition. We should probably expect more events like this, perhaps to become more frequent. And now we see how interconnected the world is and how easily things can become a major threat to health and a major disruptor. So being on a very different footing about kind of the reality of preparedness planning at a scale that's way bigger than what we typically have been thinking about when we think about public health emergencies. So that really does kind of make us think about the system and how well connected it is or isn't. The providers in Minnesota and the health plans have been very helpful to this effort as well. There's just an unprecedented degree of collaboration around information sharing, around joint planning, around making sure that we have real-time, everyday insight to what is the capacity situation, where does the load need to be balanced a little differently, where do we need to surge people and equipment and personal protective equipment, all that sort of thing. So there's never been information sharing and collaboration to this degree, and I hope we can keep that going. Within the public health community, again, this is just making us have to think about interventions at a scale that really just is not something we had given enough thought to before. And it's making us rethink our partnerships and, how do you really enlist the healthcare community, the health financing community into the effort with state and local governmental public health when it comes to things like how are we going to, really run a comprehensive testing regimen going forward? How are we going to do the kind of the basic blocking and tackling of case investigation and following up with contacts? That's going to take a much more connected network than we've had in the past.